Okay, I am Dr. Samer Albothaigi from Taiz city. I work with WHO as a national expert for Taiz and West Coast about COVID-19. I will give you an overview about the Taiz situation. First of all, I want to give my sadness and condolences about the death of my partners. Some of them on the right is Dr. Mohsen. Dr. Mohsen was working with the WHO. I am sad to hear from others that say that a healthcare worker and organization like WHO make a profit from COVID-19. Actually, we make death and we receive death and disease from COVID-19, not profit. Healthcare workers should be vaccinated as soon as possible. Healthcare infection prevention and control and PPEs are priorities. Here we can see the situation in Yemen, the first wave and the second wave, and the dormant phase between them. This dormant phase between them give more ignorance, make the community more ignorant, make the health authorities more ignorant. And I don't know from these figures that COVID-19 may become a seasonal disease in Yemen, and it can yearly. Also, we are afraid that this dormant phase could not be dormant with the emergence of new variant like Indian variant. This is a picture from the ceremony in Taiz city. They are digging more, burying more coffins and more deaths. This is a situation. This is a table showing the situation in the first wave and second wave, and the cumulative cases in the two waves in Yemen and Taiz city. As Dr. Abdullah Balwa said, in the first wave, the case fatality rate was 29, and in the second wave, the case fatality rate decreased to 13, with a cumulative case fatality rate about 19. I think the decrease in the case fatality rate and the second wave is not does not reflect an increase in immunity, but reflect an increase in the increase in the number of surveillance. Okay, this is a curve showing that Taiz government comes only after Hadramaut with the number of most cases in Yemen. Also, we can see from this curve that there is weak surveillance in the northern governorate, as Dr. Adham said. Okay, this is the epidemiological curve with epidemiological weeks of Taiz COVID outbreak and the second wave. We have reached the peak. There is about 750 cases during the second wave in Taiz city. Also here we can see the COVID-19 related deaths during the second wave. About 100 cases died from COVID-19. Also, we have reached the peak within the previous 2 weeks. This is the situation in Taiz in relation to Yemen situation. You see the curves and the curves, the red curves and the blue curves below are the situation in Taiz. And this is during the first wave and the second wave, the deaths also. Okay, here is the distribution of suspected and confirmed case in Taiz during the first wave. You can see in this curve, this is Mocha districts has only 6 suspected cases and almost no one confirmed cases during the first wave. You see Mocha district and the red arrow. Okay. After training and after probation, also this is Mocha city reported no deaths during the first wave. After training, this is figures from training in the West Coast. After training and after probation of PCR by WHO provided and the IOM provided the PCR facility to Mocha and West Coast, Mocha districts become the 5th districts in Taiz that report cases. So after some training and after provision of PCR, the case report and case catchment increased in Mocha City for about 40 cases before 2 weeks. Now it is about 70 cases today, about 70 cases, and of COVID-19 was detected in Mocha City and Mocha districts. From this curve also you can see that is the decrease in case surveillance in rural cases and in districts that are situated under healthy governments, and in case and cities and areas which lack PCR facility. This is a map of Taiz district and the West Coast. The red dots are the areas with more 100